Sure. Well, Sarah, let me just say thank you to yourself and the rest of the Nursing Home Strong Echo team and in the North Texas Health Science Center at Fort Worth. I appreciate this opportunity to visit with you all and visit with the folks on the call. Sarah said, my name is Kevin Warren. For those of you who don't know me, I do see a couple of familiar faces. President CEO of the Texas Healthcare Association. I started off 20 plus years ago as an administrator with HCR and then with ManorCare when they merged. I spent time after that working with another familiar name you all may be familiar with, TMF Health Quality Institute, where I worked with them on the nursing home team, and then many other responsibilities there. And then before coming here, I had the privilege of the responsibility of having oversight for the Texas State Veteran Homes and cemeteries, and working with the veterans across the state, and then with members of the legislature and with the commission on caring for our veterans here in Texas. So I appreciate this opportunity. Next slide, Sarah. So just briefly, with the learning objectives for my for my time with you all this morning, the first is not only to be able to discuss the impact of COVID-19 on nursing homes, and to clarify that, obviously, I think everybody on this call knows the impact, but just to really make sure that everybody is aware of, and to kind of explain to you what the impact that COVID had on the legislative process and legislative issues and priorities, and the things that the legislature found important, what we at the association and our efforts in advocating for nursing homes and assisted living and post-acute across the state, what that impact was in this last legislative session, and then where we're seeing that going as we move into the next session, which officially begins January the 12th of next year. And then to explain it, to hopefully so you understand the role that the local nursing home administrators, the local leadership plays, DONs, and others play within the legislative process, and why your voice is so important within all of these efforts. So next slide, please. This is a slide that I think if I did a presentation, if I had 20 slides that said this exact same thing every single time, I would do it, and I would defend it wholeheartedly, and to say how much and how important it is to say thank you to the efforts and the work that you all did, the work that you all continue to do, the heroes at all levels and all departments and all facets of the responsibilities that you all have. One of the things that we are spending a lot of time on right now is the world, as our communities, as our families, as we're trying to get back to whatever normal is, and with the air quotes, if you will, explaining to people that are not familiar with the everyday responsibilities and the regulations that are still within long-term care, about the fact that you all still have, you're still screening, you're still masking, you're still doing all of these requirements that have been, if you will, kind of phasing out within the communities, but COVID is still having an everyday impact on the efforts that you all are doing. So again, thank you so much for everything that you all do each and every day. Next slide. So as I mentioned at the beginning, let's talk about what the impact was that COVID had on this past legislative session, which was back in 2021. And what I wanted to list is, these were initiatives and efforts that we were focused on here at the association. There were many others, but what I think there's a theme that you'll see in terms of, as we were going in within regular legislative sessions, we're always focused on things like funding and trying to address any regulatory issues, preserving tort reform and achieving liability protections and doing all of those things. But then there were other issues that came up that were directly related to COVID that we were involved in, and we had providers coming in and testifying, reaching out to legislative offices, and so it was things like one of our big ones was liability protection. We worked with a cohort of providers across the continuum on COVID protection liability protection as it relates to COVID. Medicaid rate setting, while it's not necessarily a COVID-related issue, Medicaid rate setting is an initiative that we worked on to ensure that the commission is still responsible for setting the rates, because if it was transitioning over to the managed care organizations that are responsible for implementing Medicaid managed care, the concern being is that that COVID was not the time to be having providers having additional concerns or anxiety over how rates were going to be. Visitation access. This was actually one that we were approached and others were approached in the fall of 2020 by leadership in both legislative chambers, both the House and the Senate, on how do we address the visitation access and what do we do, because no one wanted to see the lockdowns that we saw. No one wanted to see that again. Everybody, there was a harsh and direct recognition of the negative impact, both physically and emotionally, that those lockdowns were having in terms of on what it was doing to families, what it was doing to residents, what it was doing to staff. And so how do we ensure that we don't have that issue again, but at the same time recognizing that we have a first and foremost responsibility to protect the health and safety of the residents and the staff for that matter. So we spent a lot of time on that issue. And like I said, that passed in both that passed this last legislative session with Senate Bill 25. We also worked with members of the legislature on personal protective equipment reserve. As you all know on this call and others, that was an ongoing issue that providers were having was trying to find PPE because you didn't know in what mass and what quantity you were going to need it. And then if you had a spike in your community, where was I going to get it from? And understanding what is the role and responsibility of our state government on providing this and this, or at least providing PPE as a backstop. And so that was another initiative. You can see, STAR Plus monitoring performance standards, preserving tort reform, and then as always, which is a key issue, particularly in COVID, because of the cost implications and the costs that are still continuing to manifest themselves within your communities. The Medicaid funding shortfall to enhance quality and reduce cost coverage. Again, there were many other legislative issues and priorities and things that we were working on, and we know that the legislature was working on. But I think it's important, just as kind of a background, to understand that a lot of what we were doing and a lot of what the focus on was related to COVID as we were moving forward through that session. Next slide. So last year, for those of you that are not political wonks and we're not not doing this each and every day, you were trying to care for your patients, your residents, and your own families for that matter back at home and in your communities. This past legislative session, we actually had 3 different special sessions following the regular legislative session that ended on May 31st. The 87th legislative session actually ended with the 3rd special session at the end of October. And one of the things that was in there, and this is the reason why I say kind of wait for it, was that we finally got passage of, which was Senate Bill 8 in the 3rd special session, on added additional funds that were directly used for the purposes of grants for both nursing facilities and then for assisted living facilities. This was an issue in terms of looking at Medicaid funding. It was on the charge in special session 2, but it did not come up for hearings. It did not get addressed. And then when it was back on in special session 3, we worked with our partners and with colleagues and a host of providers across the state in order to implement and to achieve these additional appropriations. In addition to this, and prior to this past legislative session, we were also spending time and working with members of the Legislative Budget Board and many others on the Medicaid add-on that still exists today as a result of the public health emergency. And that's the roughly $20 a day add-on that exists as long as the public health emergency is in effect. And so these are things, given the significance of the cost that we're seeing and that you all are having to deal with each and every day in your communities, are important issues that we continue to work on. And so when we talk about advocacy and legislation with the nursing homes, this is always, until the legislature makes the decision to address this and prioritize this in a predictable fashion moving forward, this is always going to be the #1 priority for the association because of the ripple effect that it has on staffing and environmental needs and all of the other things that are essential and important to you with the care that you provide to your patients. So right now we're in the process with the grant funding and everything that's in the funding that's going out and the appropriations that are supposed to be completed by the end of this year. All the tier 1 grants, this is $75,000 that should have gone out already to every single facility in the state of Texas. And then we get to mid-July where the the commission is going to be working with not only the 1,200 nursing facilities, but literally almost about 28,000 other providers in rolling out these grants through an RFA process over the remaining roughly 6 months. So we're going to be knee deep in this and trying to ensure that this request for application process and these additional funds get to you all and your efforts within your facilities. Next slide. One of the other benefits I would say that as a result, if you call it a benefit from COVID, if you will, is that we're seeing charges that we had not seen in the past in terms of the visibility and the opportunity that I think it's going to present itself as it relates to advocacy and legislation within nursing homes. First and foremost, the Senate, for the first time in my history here, and I've been with the association now for 8 years, the Senate Finance Committee has a specific nursing home funding charge that they're going to be looking at the nursing home, the Medicaid funding process. That hearing is actually next Tuesday on June the 14th, specifically asking, and looking at and discussing what is our nursing home funding responsibility, what is the process, what is the methodology, and what are we doing in terms of the achievement of addressing staffing and quality metrics and things like that as it relates to funding. We also have within the, not only within Higher Ed Committee, but also in Senate Health, there is focus on the healthcare workforce and the availability of. And so these are obvious, important, and priority issues that we are working with, members of the legislature and their staff, and working with other organizations on how do we address this. When we look at the fact that we already had a shortage of nursing home workforce in the state of Texas prior to COVID. And then we see that that's only been exacerbated as a result of COVID. We actually lost about 10,000 full-time direct care staff, FTEs, in Texas during that period of time. Your ranges based upon the percentages are anywhere between 8 to 15%. It's significant when we were already short. And so, we're working with, and the legislature wants to understand, what are the ways to not only bring folks back in today, but how do we create pipelines for this? How do we attempt to create long-term solutions? At the same time, the legislature recognizes and it is beginning, hopefully, to look at, when we get to the next legislative session, how do we address issues such as the fact that, I think it was in 2021, it was reported out that I think there was at least 15,000 qualified or qualified students that were eligible for nursing school, but because there wasn't capacity. And so how do we work with higher education to expand that capacity, and so that we can meet the demand and therefore increasing the supply? So working on things like that. They're also looking at issues such as the pandemic response. What is in this interim session? What was the response that the various agencies had during the pandemic, and what changes do we need to make? And how is our long-term support system? How is it working? That if we're seeing a decline in occupancy, which as an example, as we've seen about a 10% occupancy decline within long-term care. Where are those residents going now, and what are we doing to meet the needs of our older populations that need 24-hour care, or that need that assistance? If they're not coming to nursing facilities, where are they going? And then what are we doing to ensure that when they make the decision, and when they are admitted to a facility, are we ensuring that we have the resources, both financial and physical resources, and the human resources to be able to care for those individuals? Next slide, please. So what we're moving ahead. So as I mentioned to you, our focus from a legislative perspective is working on the tier 2 funding. That's the funding that I mentioned from Senate Bill 8 from the third special session. Like I said, those solicitations will be released sometime in mid-July. We are also actively working with members of the legislature here, as well as at the federal level, on where are we at in terms of how long is the public health emergency going to exist? How long is this going to be in effect? Particularly, our concern here is that when you have the Medicaid add-on that is tied to that public health emergency, We are extremely concerned, and we're making this very known to members of the legislature, that when that public health emergency ends, if that funding goes away, given that we're seeing 20 to 30% increases in costs, not only within staffing and everything else that you all are having to contend with and try to figure out ways to make it work, that could result in closures. That could result in expansion of facilities that are unable to admit additional patients because they don't have the capacity of staffing. And so how do we address those issues? The other issue that we were working on, again, both here and at the federal level, is with the expiration of the temporary nurse aid waiver. As you all know, that CMS came out and said that they're allowing that waiver to expire, and then I believe it gives until October for all of those individuals that are serving as temporary nurse aides in your communities to complete their certification and become certified nursing assistants. Or else, if that passes that time and they're not able to do that, then they can't continue to serve in that same capacity and providing that direct care assistance as temporary nurse aides. We know that here in Texas, that number of that volume is somewhere between 8,000 to 10,000 temporary nurse aides that are serving in and working in communities to help and provide that assistance, and have been doing so since this program has been in effect. And so, like I said, we're working with the commission here, with the regional office at CMS, and at the federal level on what can we do to create the ability, so that we're concerned that there's going to be a bottleneck of trying to get all of these temporary nurse aides through the system and be able to sit and test and become certified nurse aides to continue on their career path. Federal legislative efforts, those are continuing, whether it's on looking at staffing issues or funding. We've already talked about the state legislative interim charges with long-term care funding, and then the workforce, and then preparation for the 88th legislative session. We spent a lot of time working on making lawmakers aware through the interim about the issues that are affecting our communities, the issues that are affecting them now and potentially are going to affect you in the future, and then how do we connect those dots and actually put reasonable and thoughtful, not necessarily rules, but statutes into place to help improve and traject long-term care in the direction that needs to go, and so that we can continue to improve upon the care and the efforts and the role that you all play in your communities. Which leads me to, I believe, my second to last slide. So next slide, please. This is where you all come involved, and this is a slide that can't be stressed enough. That second to the slide I had earlier, that was with about thanking you all for the everyday heroes and the work that you all continue to do. There's so much that we can do here, and the relationships and all, and even with the backgrounds and the work that we do here and working with lawmakers and staff and the commission. But the saying is never more true than it is within long-term care, which is that all politics is local. And so I would encourage you, I would challenge you to get to know your legislators at both the state and the local level. Get to know the local leaders, and that's not just your state reps, your state senators, your congressman or woman, but it's also talking about your local leadership, your mayors, council persons, everybody that's in the communities, because you play a vital role in those communities. And so often what we see time and time again, and if we had more time, I could go on and on about examples of how we make a difference when there is that local relationship with a key legislator who has a local impact, because they know somebody, they see the impact, they have a constituent that's reached out to them that they've established a rapport with. And so I would encourage you, invite lawmakers and legislative staff into your communities. If you have a special event, make them aware of it. Doesn't mean they're necessarily going to come, but it's about making it personal, because again, your constituents, your voters, but you're also people that live in their communities. And so it's about allowing them to see the wonderful work that you all do in the community each and every day. I already mentioned to you before about looking for local support from local officials. This is an opportunity for alignment in the work that you all are doing. And I can tell you the number of times when I was working with the Veterans Land Board, that when we were having concerns we worked with the local leadership within those communities, with City Hall and others, because those facilities are important to them, and they were wanting to ensure that their veterans were being cared for, and so it's really important, just like with you all, because the bottom line is they don't know what they don't know. And so the more that you can make those direct connections, the more that they can see that and they can feel it, personally, and really recognize the impact that you all are making on staff, on families and residents, and on their communities, then the more impactful and the more effective we can be here within the capital here in Texas on addressing and advocating for the facilities, because they know you, and they feel that local tie to you. So with that, I close with my last slide. I've used this quote before. Is that, as it says on here, what lies behind us and what lies ahead of us are tiny matters compared to what lives within us. And to me, that is really that's long and the short of this. That last part of this is why I got into this, and what continues to drive me personally for the 20 plus years that I've been in long-term care. Because when I look and I recognize the level of effort that you all make each and every day, and the commitment that you all make, come, heck or high water, you're still going to be there each and every day, because the time and time again, you all recognize when you leave that building, you say, I can't do this anymore. I'm tired, but you also recognize that immediately, but if I'm not there, who's going to be there? And you come back tomorrow. And nowhere else, I believe in my heart, can that be said in terms of long-term care. So again, I thank you for your dedication, and Sarah, to you and the rest of the team at UNT and the Nursing Home Strong folks, I thank you for the opportunity to visit with you all this morning.